I'm going to break down NG suction insertion because NCLEX loves to test on this and they also like to trick you. So I am going to break it down very simple, tell you exactly what you need to know. No more, no less, no fluff. Let's go. First, I want you to think, why do we even place an NG tube? What is the patho behind it? When the GI tract is not moving things along because there might be a bowel obstruction, ileus, or gastric distension. Need a way to decompress that stomach. What the NG tube does is it removes the gastric content, decreases the pressure, and prevents vomiting and aspiration. The insertion basics I want you to know for the NCLEX. You're gonna measure from your nose to your ear to your xiphoid process to get the correct length. Then you're going to do a high Fowler's position to prevent any aspiration. We're gonna lubricate it and we're gonna have our patient drink water and swallow while we're inserting it. If the client coughs or they cannot breathe or become cyanotic, you are going to stop because you might be in their airway, not the esophagus. What is the gold standard for confirming that the NG tube is in the right place? An X-ray. Auscultating air is not a reliable source. Remember that. Don't let the NCLEX trick you. Aspirating the gastric content, checking the pH, is a supportive measure, but it is not your first definitive measure of placement. Suction types you'll see: low intermediate suction, usually at 20 to 40 mmHg. This prevents any mucosal damage. And then we have our low continuous suction, is used in only specific orders. Increases the risk for erosion. NCLEX usually prefers you pick intermittent suction. The nursing care you must remember: monitor your electrolytes. NG suction can cause metabolic alkalosis from the loss of all the stomach acid. Always need to assess patency because if the tube stops draining, your first action is to reposition your client. Don't automatically irrigate unless it's specifically ordered. The NCLEX wants you to prevent complications, so make sure you're doing your oral care because the mouth becoming dry is a major issue. Check the nasal skin for any breakdown. Rotate the tape and the padding. Keep the suction at the ordered level, because if it's suctioning too high, it can cause trauma. The question asks you, what do you do first when you have nausea, vomiting, or decreased drainage? I want you to think airway and positioning. Reposition your client, assess the tubing, then check the suction equipment. Remember, anything with patency and airway, that is always your priority, airway. Rule out anything else that's not related to your airway. That's all I have for NG suction. Keep it simple. Just know the basics, know the patho, and know why things are happening. If you want more information just like this, go to the top of my page and grab Simply NCLEX. It's my course that I created where I break down everything into very simple ways for you to understand things. And I go over all the patho and what the NCLEX exactly wants you to know. You'll feel lost, you're not studying things you don't need to study, and you can be successful on your NCLEX. Make sure you grab that, like, save, share this out to help out a nursing buddy, and happy studying.